Well, it's a great thrill now to be joined by Steve and Julian, who are both from France, but have been working in Cambodia in the University of Health Sciences, and their experiences of being part of the bilingual group there are good for us to hear about. Both of them have been participants on the course, and now both of them are tutors. But Steve, let me start with you. Tell me a little bit about why you wanted to join the ESME course in the first place.
Well, actually I was going to go to Cambodia to be involved in medical education, and I didn't have any background in medical education, so ESME course was like a wonderful first step to get introduced to all the skills you should have when you want to become a medical educator.
And I should explain though that this is a 12-week course, 6 key modules on medical education, and done in your own time, not as you're working.
Yes.
Yes. And you didn't get paid to do it?
Not at all, no. But I mean, I get richer by doing the course. I mean, at the
mentally
end,
richer, yes,
mentally richer.
Very good. How did you find the bilingual aspect of this course?
Well, it was really convenient for me because I didn't have any background in medical education, as I said. And as a French speaker, sometimes it's really hard to grasp all the key notions that the ESME course is actually getting us to know. So it was really convenient to have a translation, and not only a translation, sometimes an interpretation of the concept. Yeah, I found it really great to have the possibility to learn in French.
But in fact there was English material there as well.
Yeah, but luckily my tutor was giving me some documents were like made by the Canadians, and they were made in French. So sometimes when I was having difficulties to understand the document in English, it was really convenient to go to the French document that he gave me.
And how did all this work out when you were in Cambodia? What's the connection between Cambodia and speaking French?
Well, as you might know, like Cambodia has been during 100 years under the French protectorate, and it was a colonization. So a lot of people there are still speaking French, especially in the field of health. So French and English now are actually combined, and it's a great synergy, especially for medical students, to have these both languages.
And I guess, Julian, this panned out in the same way for you as a tutor, because I think that's when we first met. You were being a tutor in the course in Phnom Penh. How was it to be a tutor in 2 languages?
I think it's really interesting to have the 2 languages, because for many participants from many countries, to speak French and English, sometimes you can clarify some concepts. So I think it was a way to approach medical education concepts, which are really sometimes difficult to understand, and to explain it in French and English. So I think it's a chance to have the bilingual group.
So in the discussion group parts of the program, I guess that was particularly relevant, because it's easy to read something in English possibly, but it's easier to discuss it in French. Is that the finding? Yes.
Exactly. Sometimes in the discussion group we can explore some concept in French, and I think the discussion group are really a way for people to connect, for participants from many countries around the world, French-speaking and English countries.
And I think that raises an important point, and I'm very grateful, because I know you've tutored a large group of mixed languages recently. But the participants find that fun, don't they? Because they can share experiences.
I think this is what is amazing with the ESME course. We can share experiences from many countries.
Yes, so well done. We're very grateful to you for that. What about, let me ask you both, what do you think about accessibility of the course? Is the course more accessible, do you think, in Cambodia, because it has the bilingual aspect to it?
Well, to me it seems like currently the fact that the course will be taught in French and English will make maybe, because in Cambodia you have like kind of 2 groups, the students who are loving more to learn French and the students who are loving more to learn English. So I think most of the students right now who are involved in medical education are the ones who are the most influenced by the English, Anglo-Saxon culture. So having a group which is bilingual will help maybe to make medical education interesting to students who are interested by French culture too, in French language.
There is an aspect too that the course is possibly more accessible in this way to places with limited resources or limited income to spend on education. I don't know if that's true to say
No, it could be. There are some countries where we are. They are really moving fast on medical education. I was thinking in the north of Africa, we have a lot of participants from Morocco, and so it's French-speaking countries academically. I mean, so it's a good way for them to go in medical education.
Yes. What do you think about translating? Is that, if you're both going to cooperate in translating some of the material, is that going to be a difficult task, or do you see problems along the way?
Some work have already been done by French group that are translating some concept, but I think it can be a way to explore more concept in French.
Yeah, indeed. I mean, translation is it's not always word by word. So as I said, like word like empowerment, there is no translation in French, so it's really hard to actually create the same concept. But yeah, we have French. I think the people from Quebec could teach us a lot about that, because they are professional in the field of always trying to avoid English terms.
Of course. And it's important, I think, too, isn't it, to make sure that the course and the material still resonates in Cambodia with a third nationality, as it were.
Yeah.
Grand. Well, best wishes to you both for that, and thanks for joining me to take part in this short interview together. Thank you.
Thank you, John.
Thanks.